We're back. We're here with Greg Crossman. He is a physical therapist and owner of the Complete Game Physical Therapy. We appreciate you coming on the show, Greg.
Thanks for having me, Joe.
Absolutely. So you've got like 4 designations here: DPT, OCS, COMT, CSCS. Tell us a little bit about what those designations are and what it is that you do.
Sure. So my background is I'm a doctor of physical therapy. I've also gone on to get some kind of continuing education, some certifications. I've got my orthopedic specialist certification, my COMT, which is Certified Orthopedic Manual Therapy certification, and also strength and conditioning certification through the CSCS.
Wow. So tell us a little bit about what physical therapy is. Most people may or may not have gone through it, depending on whether they've ever been injured or. Great
question, actually. We get asked that a lot, or a lot of people think they know, and they don't totally know. They think we're chiropractors or trainers. We're kind of what physical therapists do, or they help people. We're movement specialists, so we really help people kind of regain function and regain movement, most typically after an injury, to kind of get back to the activities that they like to do.
So my wife's a nurse, and she believes that after surgery you should get up and get moving, and that's the quickest way to recovery. Is that true, or?
Typically, yes. Typically, what they're finding now is the more you get moving. They used to kind of prescribe bed rest a lot and those sorts of things, which they've kind of moved away from, and now they know the more you move in most situations, the quicker you're going to recover.
Now, if what is probably the most traditional way somebody ends up seeing you? What is it that occurs?
So typically, we'll get referrals from a doctor. So somebody will have an injury or a pain or something that they need to see their doctor for. They see their doctor, and then their doctor will refer them to physical therapy. That's the most traditional way. But we also get a lot of referrals from word-of-mouth referrals from former patients. Maybe somebody tells their friend about a shoulder pain they've been having or a knee pain, and we'll get calls that way. At Complete Game, we work with a lot of athletes too. So we have a great network of trainers, coaches, and those sorts of people that will refer to us as well.
Now, you're the owner of the company. Are there other people that work with you as well, or are you solo?
Yes, there's me. I'm owner and therapist there, so I work as a therapist. I also have another staff therapist as well.
Oh, wow.
Yeah.
So give us kind of like a day-to-day as to what you go through, how you work with people, what does a regimen look like?
So kind of overall, what we do at Complete Game is we help active people and athletes kind of get back to their activities without losing, valuable playing time, or their competitive advantage is kind of what our main focus is. Like I said, we see patients from all walks of life, though. We see not just athletes. We also see, everybody from 4 years old to 90 years old. And what we'll do is we'll bring them in. The first time they'll meet with their therapist, which will be their therapist through their whole course of treatment. We'll do a full evaluation where we sit down and really talk to them, get to know them, want to understand what their goals are, what they're trying to get back to. And then we'll do a physical assessment where we look at strength, range of motion, flexibility. And then in that first visit, we want to make sure that they start to have a program that they can start working on with some home exercises and some stuff to get them working towards their goals right away.
So if somebody has an ailment of some sort, give us an example of maybe somebody you've taken from having that ailment to, I guess, being completely back to where they want to be. Have you ever had anybody that's made that kind of recovery?
Yeah, we see that sort of thing all the time. So, one of our specialties is baseball. I have a background in baseball, and so we see a lot of baseball players. So, I've had several baseball players who have had, and one example is Tommy John surgery, which is a common surgery in baseball players, unfortunately now. But we'll see them, usually we'll see them within second to third week after their surgery. First week they're in a cast, and then once they get that cast off, they usually come right in and see us. We take them through getting the range of motion back, getting the strength back, and then the nice thing about our location is we're actually able to take them in and have them throw when they're able to do that. So we can take them all the way from day one where they can't move their arm at all the way to being able to pitch again or play the field again and throw a baseball again. So that's a really nice to be able to follow them through that full continuum of care.
Now, do you find a lot of these injuries happen because people don't spend a lot of time with warm-up or cool-down, or is that at all related to this?
It's a huge component. Proper warm-up is key, and what we're finding is, even at younger and younger ages, kids need to start warming up and learning how to take care of their bodies properly. We see it all the time and hear the story all the time of, even the young kids who are going from one practice to another and kind of jump right in and end up getting injured. Or the older athlete who maybe doesn't stretch out properly and goes out there and tears an Achilles or pops a hamstring.
How painful is that injury?
It's not comfortable.
I've had quite a few friends that have popped their Achilles, and it's something that I actually personally think about all the time, which is why I actually stretch, because it sounds like it's really not only painful but hard to recover from. Is that true?
It's a long recovery. Yeah, it's a long, uncomfortable recovery. So definitely stretch your calves before you go out there and run.
What are some exercises or things that you do with people that have had say an Achilles issue once they've had, I assume, surgery?
Yeah, so again, surgery, and then you're looking to get their range of motion back, which takes quite a while. But then strengthening exercises, we're mainly focused on a lot of body weight exercise initially, and then depending on what their goals are, if they're an athlete looking to get back into sports, we'll work towards that. So, if we need to get them back to running and cutting and doing those sorts of things, we'll look at that. One thing that it's nice with us is we have a great network of trainers like Justin. So if it's someone who's working with Justin, we can kind of work them right back in towards the kinds of workouts that they do and get them ready to go back to that.
Do you ever use any sort of ointments or, oils or something to try to loosen things up? Is that ever part of the process?
We do a lot with manual therapy. So we do a lot of hands-on soft tissue massage, joint mobilizations. We use massage cream when we're doing massage to glide over the skin. But we're very heavily manual-based clinic. So we really believe that getting our hands on the patient and being able to especially to get the range of motion back in the joints and get the soft tissue quality back in the muscles is key.
I think if anybody's watched Tom versus Time, they've seen his trainer kind of doing some pliability type stuff. Is that at all similar to what you guys may be doing on a day-to-day basis?
Yeah, absolutely. So, a lot of the massage and the stretching and those sorts of things, every treatment somebody comes in to work with us, there'll be some sort of manual treatment. So they'll get some massage work done, they'll get some stretching done, again, depending on exactly what they need to reach their goals. So we do all of that sort of manual resisted work, soft tissue massage, like we said, the stretching to work on all those sorts of things.
Was there something specific that got you interested in being a physical therapist? Was there a passion that you had there?
Yeah, so I was an injured athlete in college, and it got me out of athletics, but got me into physical therapy. So it turned out okay. And as I was going through physical therapy, and even as I got my degree and continued to work, what I really found was clinics were kind of set up one of two ways. They were either kind of really a clinical doctor's office sort of setting, or it was more kind of open factory where it was kind of like you were kind of run through like just a number. And I really wanted to open a clinic that was different, that was more comfortable for athletes and active individuals. So our clinic is great in that it's kind of open training room style, but it's small, and you see your same therapist every single time. So it's comfortable for younger people to come through. We're all there working together, and a lot of times they'll see their teammates or their classmates in there, and they feel comfortable there. We also do have some private treatment room if somebody does need more privacy. But that's kind of why I wanted to open my own clinic and kind of what got me into PT in the first place.
Where are you guys actually located?
So we're at 1703 Middlesex Street in Lowell. We're inside the Game Time Sports and Fitness building.
Okay. And tell us a little bit, the Game Time Sports and Fitness, that's like a multi-field type of place? Or?
Yeah, so there's multi-sports inside the building. There's a baseball batting cages in the building. There is basketball courts. We got 2 basketball courts on site, 3 volleyball courts on site. There's also a big turf area that we have access to. So it's kind of nice, especially again for those athletes. We're able to use everything in the building. So as they're able to get back into their sports, we can bring them in the batting cages and have them hit or have them throw. We can take them to the basketball court and have them move around. Volleyball, have them, jump and move around on the volleyball court before they go back, or on the turf. If they're a turf field athlete, we can run and cut and kick around soccer balls and do that sort of stuff. It's also nice because we see a lot of athletes that have teams that practice in the building. So, one aspect of an injury, especially to a youth athlete, is the mental aspect, the psychological aspect, where they're missing time with their team. And we're able to schedule a lot of times around when their teams are in the building. So they'll go start with their team, come over and see us, do some of their PT, and then get back to finish up, with their team, so that they're able to kind of keep the friendships and that continuity with their team. It really seems to be helpful and works really well.
Do you suggest to people that have had an injury, let's say it's like a leg injury or whatever, to try to continue to do, physical workouts that may just kind of leave that one area alone, but kind of, work all the rest of their body?
That's actually hugely important to keep moving, right? You don't want to lose, especially if you've been working out for a while or been training for a while, you don't want to lose all that training effect, and you may not have to. So again, after we do an assessment of the injury and make sure you're safe, that's where it's nice, where we can talk to trainers. If you're working with a trainer or talk to a coach, there may be things that you can kind of continue to do, and you may not miss all that much time, but still be safe and kind of work around an injury while we work with you to get that injury better.
Now, do you ever work with back injuries at all, or do you typically refer those to a chiropractor?
No, we see back injuries as well. And that certification I have, the manual therapy certification, I'm actually certified in spinal manipulation as well. So I can do some of that. High level, really involved cases, I'll often refer out to other providers. But we see back problems, neck problems, all those sorts of problems as well.
Do you ever use any sort of technology at all, or is it all just hands-on physical?
I'm getting involved in a little more of the tech side. One of the technological pieces that I'm using now is called a Modus sleeve. Again, it's for baseball players, and it looks at it's a biomechanic motion sensor that looks at arm angle. It looks at stress on the elbow, especially. Looks at arm speed, a few different parameters, and we're kind of able to kind of take a look at how a kid throws and see if they're putting too much stress on their elbow. And then again, we'll work with the pitching coach or the throwing coach and try to figure out, is it a mechanical issue or is it a physical issue, and ways to kind of reduce that force and keep them safe.
That's awesome. If people do want to meet with you and fix their ailments, what's the best way to go about getting a hold of you or schedule an appointment?
Yep, they can certainly call the office. Our number is 978-710-7204. Our website, completegamept.com, has all our information on it too, and that has my email on it as well. You can email me as well. Any of those ways work great. We've got appointments, usually same day appointments. We've got Saturday appointments, so we try to be as flexible as possible for people.
Awesome. Well, it sounds like you guys offer quite the service there, and if somebody is injured or ailing, certainly they should reach out to you and give you a shot.
Great. Thanks
Awesome.
a lot, Joe. Really appreciate it.
Well, we appreciate you coming on the show.
Right.
Thank you.
Thank you.